Welcome back. Today we take a closer look at new findings from the Centre for Market Education, which reveal how illicit tobacco continues to affect government revenues across Southeast Asia. Now, according to CME's latest policy brief, ASEAN countries could see more than $11 billion in potential fiscal losses over the next 3 years, revenue that could otherwise support healthcare, education and broader development priorities. Now, to help us understand the scale of the issue and what it means for the region's economies, we're joined by Dr. CARMELO FERLITO, Chief Executive Officer of the Centre for Market Education. Dr. FERLITO, thank you for being with us. Now, Dr. FERLITO, your latest CME policy brief highlights that ASEAN could lose about $11 billion to illicit tobacco by 2028. What are the main factors contributing to this challenge, Doctor?
Hi, good afternoon, and thanks for having me. So first, a clarification on the methodology. So what we are talking about here is lost fiscal revenues. So we took official data on illicit tobacco trade incidents country by country in ASEAN, for those countries where data were available, of course. And then we took official data on the tobacco excise duties. And then we made a proportion. So given what is collected, we could calculate what gets lost. And we came out with a cumulative figure for ASEAN of $3.69 billion based on 2024 official data. So which are the factors? Of course, ASEAN is an area made of different countries and different situations. But if I had to summarize and identify a few key elements, I would say that first and foremost, we have to consider that human beings like to consume products that are believed to give pleasure to them. And therefore, when the fiscal regulation or the consumption regulation becomes extremely punitive, rather than reducing their consumption because of that regulation, they shift the consumption toward, let's call them alternative markets or black markets. So I would say that the complicated and often punitive institutional framework is an incentive to drive consumption toward black markets. And together with sometimes a lack of enforcement also at borders and so on. But I would say that the type of regulation is the primary source of this phenomenon.
Now, I understand the region is currently missing about $3.69 billion in excise revenue each year. From your perspective, how does this affect governments as they plan and prioritize essential services like perhaps healthcare and education?
Yeah, indeed, if you look at our calculations, we have estimated that these lost fiscal revenues are equivalent to around 7.6% of the total healthcare expenditures or healthcare budget of the ASEAN region and 3.63% of the education budget. Of course, with very big differences country by country. But this is quite significant because just to use some example to make the public aware of the scale of the phenomenon, we have estimated that the lost revenues, in example, in Indonesia are $1.68 billion. Now, according to the Ministry of Finance, the free nutrition meals, the so-called free meals program in Indonesia, thanks to $1.23 billion, have produced 31 million beneficiaries or free meals for the people. So it means that only with the fiscal revenues that are lost, we could finance another 42.6 million meals for Indonesian poor people, poor Indonesians. Coming back on to Malaysia, if we look at the lost revenues that we estimated of 770 million US dollars. These are almost equivalent to what the government estimate to be 1 year of saving coming from subsidy rationalization, petrol subsidy rationalization, which is 950 billion US dollars. So we could basically double, almost double the saving from subsidy rationalization.
Now, your report also outlines the situation in several countries, including Indonesia and Malaysia. I'd like to know what are some of the underlying conditions that make certain markets more affected than others?
I think that I would like to take here two extreme cases. One is Malaysia. Malaysia is an extremely small market, obviously due to the nature also of the population, the size of the population, but illicit tobacco penetration is among the highest in the world. It is estimated to be around 55% of the market. So this translates into the revenues for the government coming from tobacco being lower than what is lost. So a sort of applied Laffer curve, if we want to call it like that. Malaysia loses more than what it gains from taxation on tobacco. So the loss is considerable because the illicit trade penetration is considerable. Indonesia, on the other side, has a lower penetration of illicit trade, just 10.6%, but due to the huge scale of domestic market for cigarette, this 10% of illicit trade produce around 1.7 billion US dollars of fiscal revenue loss, which is around half of the regional loss combined.
Now, illicit tobacco is often linked to wider illegal activities. Could you help our viewers understand how this trade fits into the broader picture of organized crime in the region?
Well, I think in one of our previous reports that was released in September, we have brought some examples of other illicit trades in the region. I quote here, so only counterfeit products is estimated to be a turnover of 35 billion annually. Myanmar illicit trade on gems, timber, and alcohol is 4.6 billion US dollars per year. In Vietnam, 57% of the alcohol consumption is unrecorded consumption. So what does it mean? This means, in general term, that illicit trade is not just harming fiscal revenues, so affecting fiscal revenues, but also affecting tax equity. And basically, the fiscal burden is borne by law-abiding consumers and law-abiding producers, because the extent of illicit trade, of course, create distortion in the market and reduce the market penetration for those players who plays according to the rules of the game. So this is, I think, something that we have to keep very much in mind. We are not just harming fiscal revenues, but we are harming legitimate producers and traders of products.
Well, Dr. Ferlito, thank you for sharing your insights. That was Dr. Carmelo Ferlito, Chief Executive Officer of the Center for Market Education. Thank you.